Hey everyone, welcome to another episode of Ask Dr. J, and today I've got a question that you may not have thought to ask. Are my teeth slowly melting away because of acid? So I want to talk about three different things as it pertains to acid. Sources. So there's two main places that acid come from, either within the body, what we call intrinsic, or the things that we put into our body, which we call extrinsic. So let's talk about the first. Body acid or intrinsic acid that's coming from the stomach comes from two major forms. The first would be if you're nausea and vomiting. That could be morning sickness. That could be someone that's going through radiation or chemotherapy, other types of illnesses. That is the most caustic or damaging acid to the teeth, and actually the pH of that is basically as strong as the same as a car battery, and that type of acid will basically blow right through your enamel, the outer shell of the teeth, the hardest part that we have in our body. So if that's something that you have, you got to get that off your teeth immediately, either by rinsing with water. You don't want to put a toothbrush on the teeth and brush right away, because now you're scrubbing acid with a brush and causing more damage. So you've got to reduce the acidic content with water, possibly even baking soda, to neutralize that acid first. Then you can go ahead, wait maybe 10 minutes and clean your teeth. The other way is gastric reflux or heartburn, some people call it, and that's when the acid slowly creeps up into the mouth. Sometimes when you're sleeping or laying down, it's worse, and we see a pattern where it affects more the tops of the teeth, of the back teeth, and the insides of the teeth, and it can slowly melt away the enamel, reaching the next layer of the tooth structure, which is called the dentin. So this is not as damaging as acid that comes from vomiting, but it is damaging, and best ways to prevent that is see your physician. You might need to get a medication to help that, to reduce the acid from coming up, and some of the signs of knowing if you have that are your dentist may be able to tell you, because often you may not even have symptoms of this gastric reflux, heartburn. So that's source number one. Source number two is when with the things that we put into our body. So what could that be? Number one, energy drinks, soda, especially if it's citrus soda like Sprite, that's actually more acidic than Coke, believe it or not. Energy drinks, there's so many of them on the market. I happen to be guilty of that habit myself. Fruit juice, tomatoes, vinegar, wine, all these things, when they're put on the teeth, slowly start to damage and melt the teeth away, especially if you grind your teeth and the tops of the teeth are already worn down. Then you can start to get these little craters or potholes in your teeth, and that's because the second layer is starting to melt away faster than the enamel, because it's not as strong as an acid as what we just talked about. So you got to be real careful of what you drink, what you eat, and understand it's not just about sugar, it's about acid, and it's a slow thing that can help your teeth slowly start to melt away. So what do we do about that? Number one, obviously, try to stop drinking or putting these things in your body. Number two, get water in after you drink an energy drink or you have a soda, and get that off your teeth. And the third thing that people may not be aware of, let's say with sports beverages, Gatorade is meant to drink fast when you're thirsty, but if it's something you sip on, the same with soda, and you do it all day, each time that hits your teeth, you're getting a bump of acid, pH goes down, acid goes up, damage occurs, and it's happening with longer exposure time. So if you're gonna have one of these beverages, try not to extend it over hours, and just try to drink it, clean your teeth with water, and move on with your day. So these are the sources. These are how the acid gets into the body, either from within or what you put into your body. And we kind of talked about it, but what acid does to the tooth structure is it slowly melts it away. There can be combined factors, like we talked about, acid with scrubbing a toothbrush, acid with grinding your teeth, acid with abrasive foods, that causes more damage. And the stronger the acid, the more damaging it is. So the stronger the acid, the more likely that you'll lose the outer shell of the tooth, the enamel, which is really important, because once that's gone, you never get it back without putting ceramic on your teeth. So some of the ways that you can offset or mitigate the damaging effects of acid is, number one, stop putting these beverages in your mouth and your body. And if you're going to drink an energy drink, remember to reduce the exposure time. Also, drink water after to get it off your teeth. The other thing would be, if you slightly might even think you have heartburn or gastric reflux, go see your physician so you can be put on the appropriate medication to reduce and suppress that acid. If you're somebody that may have morning sickness or vomit because of some other type of medical condition, make sure you get that acid off your teeth immediately. Try to neutralize it with baking soda or some type of other product that can get it off your teeth and get the acid level down. So these are some of the ways that you can reduce the damaging effects of acid in the mouth, and hopefully this was helpful information. If you have any questions, feel free to add a comment or ask a question, and thank you for watching another episode of Ask Dr. J.